Most patients that I work with think the pelvic floor needs to be nice and strong in order to get your baby out, when in reality, the pelvic floor just needs to relax and get out of the way. It's the involuntary contractions of your uterus that is responsible for pushing out your baby. Most hospitals participate in what we call a coached pushing strategy that puts a lot of strain on your pelvic floor. And while this is an effective strategy to get your baby out, it does increase your risk of tearing and other pelvic floor injuries, prolonging your pelvic floor in your postpartum recovery. There is a better way to push that puts less strain on your pelvic floor, reduces your risk of tearing, and lets you work with your body, not against it. And I'm going to break that down into 3 parts. Part 1, learn how to breathe through your diaphragm. Start by taking a slow inhale through your nose, filling your belly with air. So really direct your air low through your ribs to fill your belly in a 360-degree plane of movement. As that belly is expanding in all directions, it's also gently pushing downward. And that downward movement is what's going to gently stretch the pelvic floor, causing it to relax and lengthen. Part 2, learn how to engage your deep core. In between your diaphragm breathing or your belly breaths, take a nice exhale through pursed lips like you're blowing out a candle. As you're exhaling through your pursed lips, also engage your deep core like you're hugging your baby. The deep core has a wrapping effect, so you can visualize your hip bones pulling together, your ribs pulling together from the bottom up. And it's key to do this while you're exhaling through those pursed lips, because that automatically engages your deep core. Now, third and most important step, make sure your pelvic floor is relaxing and not contracting or tightening. Generally, when you tense or tighten your deep core muscles, the pelvic floor will want to contract along with it. But during labor, we actually want to train the muscles to do the opposite of that. So your deep core is contracting while your pelvic floor is lengthening and relaxing. You can almost think of like patting your head and rubbing your stomach. It can take some time to get down, but with practice, you should be able to coordinate it. You can also think of a tube of toothpaste. If you're contracting or squeezing the middle of the tube, this will allow the bottom part to open and toothpaste to come out. So if you were contracting here, but the bottom part was shut, you could see how that would be a problem. This is the same case if your pelvic floor was contracting when it should be relaxing. Start by practicing all of these steps individually and then tie them together when you're ready. If you're unsure if you're doing it right, don't worry. This is very common in the beginning, which is why we've created Optimized Birth. And this is our comprehensive birth preparation guide that walks you through targeted exercises and other birth preparation strategies to reduce your risk of tearing and to prepare you to have the empowered birth that you deserve.